A good way to start your decontamination is to use up any water in your patient's rinse cup, or even refill it so that water can be run through the suction after every patient. Purging or flushing the water lines needs to also be completed at this point, so run water through both your triple syringes and high-speed handpiece that was just used. According to the Australian Dental Association, air and water lines from any device connected to the dental water system that enters the patient's mouth, example handpieces, ultrasonic scalers and air-water syringes, must be flushed for a minimum of 2 minutes at the start of the day and for 30 seconds between patients. When decontaminating between patients, always maintain the use of appropriate PPE. Glasses, mask, apron and gloves should remain on from when treating the patient. Start by removing all used instruments and rubbish. Barriers should also be removed at this point, making sure not to contaminate any unnecessary areas. Work in a flow that works best for you and your surgery. Make sure that you contain all dirty instruments and rubbish into one area, removing everything that can be either autoclaved or disposed of. Be mindful of your decontamination process and promote high to low, clean to dirty protocols. Also take care to correctly segregate sharps. Barriers can sometimes pose a problem with placement and removal. Be aware of this and if needed, place using techniques to enable quick release. Contaminated instruments should be carried to the sterilising area in a manner that will minimise handling and prevent the potential for a penetrating injury. The contaminated instrument should be carried with gloved hands to the cleaning area and placed on the dirty side. The gloves must then be taken off and hands either washed or disinfected. Alcohol-based hand rubs may be used in accordance with current national standards or guidelines. Wearing new PPE, start your swabbing technique. Using 2 swabs, detergent and a 2-hand technique, start your swabbing on the nurse's side. One hand remains clean while the other initiates contact with the contaminated surface. Once swabbed, move items that are clean into a non-contaminated area. On flat surfaces, work in a manner that does not spread microbes back onto already clean surfaces. Do this by using a sweeping technique. From the nurse's bench, move to the light, including handles and switch. When starting the patient's chair, again high to low, not leaving any area untouched. Make sure that you include the headrest, back of the chair and armrests. This first swab can now be disposed of. The second swab is used for the dental bracket, handpiece couplings, triple syringes, suction and spittoon area. Even if surfaces were protected with barriers, it's important to swab there regardless. When swabbing triple syringes, handpieces etc., swab the equipment first before picking up with your clean hand and moving down all the way along the cabling or hose about an arm's length before finally swabbing the resting place and returning it to where it sits. Repeat this process on the nurse's side, making sure to only use your clean hand to pick up equipment that has already been swabbed in a methodical manner. Finally, swab the area where the patient's cup was sitting, the external part of the spittoon first, then the dirtiest area, inside the spittoon. This second swab, along with gloves and mask, can now be discarded. Once dirty gloves and mask have been removed, your hands need to be cleaned. When washing hands with an antimicrobial soap, wet hands under tepid running water and apply the recommended amount of soap. Rub hands together for a minimum of 15 seconds so that the solution comes into contact with all surfaces, paying particular attention to the tips of the fingers, the thumbs and the areas between the fingers. Remember to turn the tap off with an elbow or the use of a paper towel if necessary to maintain asepsis.